welcome to my YouTube channel. If you're not already subscribed, make sure you hit that subscribe button and turn on post notifications so that you never miss a video. If you are new to the Career Savage community, Career Savage is all about providing up-to-date and relevant career advice for working professionals and especially college students so that you can make informed career decisions. Today, I'm going to be talking about health economics, outcome research, and market access. I'll be talking about everything from how to get a job and health economics, outcomes research, what the industry is like, and things that you'll be working on. So make sure you stick around and watch the entire video. Make sure you also like, share, and comment on this video. All right, let's get started. So normally when I do videos like this, I do a little bit of research because I don't like to give you guys information that I'm not 100% or I can't stand behind it 100%. So I actually have a definition of health economics, a definition of outcomes research, and then a definition for market access that I'm gonna read off of my computer for you guys. Okay, so health economics analyzes the economic aspects of health and healthcare with a focus on the cost, which is the input, and consequences, which is the outcome of healthcare interventions. So a lot of pharmaceutical companies will have a health economics department to kind of help them make informed decisions for the products that they have marketed, and even health economics before they begin to market a product. So outcomes research evaluates the effect of healthcare interventions on patient-related clinical, humanistic, and economic outcomes. So when a drug is approved by the FDA or Health Canada or any other health authority, outcomes research kind of economically explores the outcome of that health intervention, of that approved drug, of that approved product. So when you look at programs like Tylenol, or every single time I talk about different approved products, I can never come up with them. When you think of products like Breyanzi, which is a BMS product, Tylenol, which is Pfizer, or I'm sorry, Advil, which is Pfizer, Albuterol, I don't know, different narcotics, they look at the outcome of all those products to help them make decisions for pricing, help them make decisions with payers, help them make decisions as well in terms of like labels. I'll get into more details about different things that they do to inform those decisions, but a lot of great information comes from the health economics outcomes research division. So what is market access? Market access is simply eligible patients having rapid, consistent, and sustained access to medicines, generating and communicating data for stakeholders involved in the adoption and funding of a drug. So like I said, a lot of this information helps them make decisions with payers or insurance companies on how to price a product. So market access makes sure the products and services are fairly priced and reimbursed. So when you see some approved products will have patient access program. For example, Indari, which is a pharmaceutical product for Emmaus Life Sciences, that's the name of the pharmaceutical company. Indari was approved for people with sickle cell disease. And I don't know exactly what the label says, but in terms of market access, they may have patient assistant programs to help pay for the drug. And there are so many different companies. You know, GoodRx isn't a pharmaceutical company per se, but they definitely have an health economics outcomes research division as well as market access. So what are the primary responsibilities of someone who works in HEOR or market access? And going forward, I'm just gonna say HEOR because it's a whole lot to say health economics outcomes research every single time. Some of their responsibilities might be evaluating real world evidence or real world data. And real world data is patients who are actually using the drug. We're out of the clinical trial phase now, phase 1, phase 2, phase 3. We're in the post-approval process where we need to analyze how patients are using the drug, how people are prescribing the drug, what's the frequency? Is that frequency necessary? And honestly, even though pharmacovigilance is its own world, pharmacovigilance kind of comes into that market access, real world data, real world evidence platform, because one thing that they always monitor is safety even after a product is approved. So that's one thing that people in HEOR might be responsible for. Another thing is developing and writing, generating actual studies. So I think I said before in one of my videos, Pharma 101, that phase 1 is your early research into your product and to see if it's safe in humans. That's what phase 1 is. Phase 2 is you have good amount of safety data in about 50 patients, and now you're moving into looking at preliminary efficacy, but also trying to add more to your safety profile. And then phase 3 is that big, robust clinical trial determining the efficacy of your program. And you only need phase 1 through phase 3 to, submit an application to the FDA or any other health authority for approval. But there's something called phase 4. And phase 4 is a lot of times it's patient registry studies. You can go on clinicaltrials.gov and look at all this stuff, but patient registry studies following patients, evaluating patients who have that specific disease that you were treating with your drug approval or whatever. Sometimes the agency will make you do a post-marketing commitment or a post-marketing requirement to keep evaluating the safety of your product. I am 100% sure that a lot of the COVID biologics that have been approved, 1000% have to continuously monitor the safety of their patients and really look at that real world evidence and real world data to better inform the overall product. There are some specific types of studies that I want to read off for you guys that people in HEOR might be responsible for formulating. So the first one I already said was patient registries. The second one might be a retrospective analysis of computerized data. So patient charts, electronic medical records. That might be something that they analyze to see how patients are treated and how physicians are prescribing. Another one is manual chart reviews. Another one is prospective observational studies. And when I say retrospective is looking backwards, whereas prospective is looking forward. So a retrospective trial in health economics outcomes research might look at previous electronic health records, whereas prospective might look at something specific in the future. And the last one I want to mention is economic modeling. So these are just some general studies that people in HEOR might be responsible for working on. And of course, it depends at the level that you're at. Of course, if you're an associate director, you're probably responsible for executing those clinical studies. Whereas if you're an associate, you might just be more of a supporting role in helping develop the strategic plan for their health economics outcomes research. So I mentioned before that there are different phases, phase 1, phase 2, phase 3, and I kind of wanted to list out where HEOR steps in at each of those phases. We all know that it's not only when a drug is approved that you're looking at the health economics or outcomes of anything, of whatever you're doing, of your product. So for preclinical, which is essentially in animals, it's not in humans yet because it hasn't been generated safe for humans. They need to do more toxicology work, some more pharmacokinetics, pharmacodynamics work. So a lot of pharmaceutical companies will test in animals. But at the preclinical stage, the health economics outcomes research division might complete the following. They might be doing a market assessment. The next thing they might do is exploratory research. The next thing they might be doing is addressing the unmet need or gap of that actual product. So let's say you're researching sickle cell. What is the unmet need? Are there other approved products out there? What are those approved products like? How fast do those approved products get approved? So health economics is really important in the foundation of a good product. In phase 2, something that HEOR might be responsible for is similar. I mean, throughout all the phases, you're going to be doing, market assessments to see, is there a market for this product? And then you're still addressing the unmet need. When you get into phase 1 and phase 2, you might be focused a little bit more on the burden of illness. When I say burden of illness, it's in terms of, again, sickle cell as an example, patients experience these really painful crises. That's the burden of the illness, is that they live in hospitals, their life expectancy is lower, they have a lot more pain. You also have to look at the healthcare system in terms of how they treat sickle cell patients. So a lot of sickle cell patients may be going through crisis, but they don't get prescribed narcotics because people think that they're addicted to opioids, when in reality that crisis is so painful that the only thing that can help ease the pain is that opioid. So those are the things that people in health economics might be looking at as they're developing this product. So at the phase 3 and phase 4 stage, you're doing payer assessments. Oh, my AC just turned on, so if there's any background noise, you guys will just have to excuse that. But like I said, in phase 3, phase 4, you might be doing payer assessments, safety surveillance, safety reviews, and this is really when those, especially at the phase 4 stage, where those prospective registry patient studies come into play to kind of monitor how the product is actually moving in real life. That's all I'm going to give you guys for today. In my next video, I will be talking about who is qualified to get a job in health economics outcome research, what you need to do, the different qualifications. But this video is really just to give you a little bit of insight into what that world is like, what HEOR is like, and the things that you might be responsible for if you're interested in it. Make sure you subscribe to my channel so you know when I post that second video. I'll also link it down below after it's filmed. Until next time, guys, thank you. Bye.